Hello everybody, I'm Dr. Subin Philip. I'm Senior Resident in the Department of Clinical Immunology and Rheumatology of the Jipmer Hospital in Pondicherry, India. This video has got spinal mobility exercises that can be done simultaneously along with me. It's primarily for anyone with a backache, especially those with spondyloarthritis. Apart from the various conventional therapies, the ASAS, ACR and EULAR advocates non-pharmacological physical or exercise therapy that has been found in various studies and RCTs to have a synergistic effect to various treatment modality, improving the pain, spinal mobility, functionality, and reducing the cardiovascular risk. It should just take 13 minutes a day, can be done at least 4 times a week, and if you have got any discomfort while doing the same, you should stop it immediately. So enough of talking, let's go ahead with the exercises. We start with high kneeling. Put your right chin on the shoulder. Push it down with your right hand. Feel the stretch. Now shift to the left side. Push it down with your left hand and then stop. Now extend your neck to feel the stretch to your back. Then flex your head. While flexing, keep in mind to tuck your chin inwards. Now use your left hand to resist the lateral flexion of the head, strengthening the muscles, followed by the right hand. Then resist the backward extension, followed by resisting of the flexion of the head, strengthening the neck muscles. Next is the lateral flexion. Move towards the right, stretch with the opposite arm, followed by the lateral flexion towards the left, and move the opposite arm to feel a nice stretch. After this comes the spinal rotation. Move towards the right and use the opposite arm to stretch it, followed by the left side, feeling a nice stretch. After this comes the forward stretching. Imagine hugging a big ball towards the front, followed by stretching towards the back side. Extend your head to feel a nice stretch towards the back. Now lie down flat, supine. Lift your right leg upward. Hold it to the thigh. Move your foot up and down to feel the stretching of the sciatic nerve. Now move the leg towards the opposite side to feel a greater stretch. Repeat it in the opposite leg. Move the foot up and down to feel the stretching of the thigh, moving the leg towards the opposite side for a greater stretch. Now for the spinal twist, move the hands and feet to the opposite side, feeling a good twisting crisscross motion. Going to the opposite side, feel the nice twist of the spine. Repeat the same a couple of times to feel a nice stretch to the back and thighs. Now for the stretching of the hip joint, flex the right hip as a figure of 4, hands on the thigh, try to pull it towards the chest. Use the left elbow to push the opposite legs to feel a nice stretch. Repeat the same for a couple of times to feel a nice stretch on the hip joint. Next, bring both your knees towards the chest and hold it with both the arms, rocking side to side, feeling the stretch to the lower back. Repeat it a couple of times. Next is the gluteal bridge. Lift your hip upwards, feeling a stretch on the gluteus muscle and the lower back. Hold it in this position to feel a nice stretch on the back. Coming back to a high kneeling position. Spinal twist. Use your right hand to grasp the left calf, then the left hand to grasp the right calf to feel the stretch. This can be followed by the cat camel position. Arch the back and then flex the back. Now lift the hip, bend your left leg, stretch your right leg, bend your right leg and stretch your left leg. Stretch both the legs. Feel the nice stretch. Bend down to a child pose. Feel a good stretch on the back. Next is the cobra pose. Extend your neck and the back. Lift your chest. Feel a good stretch. This can be followed by the Superman pose, in which lift your right hand and the left leg, followed by lifting the left arm and the right leg, opposite arms and leg, stretching the back, thigh and arms. Standing up, bending forward, feel the nice stretch on the back. This can be followed by the extension of the spine, feeling a nice stretch, extension of the neck. Next, coming to the dynamic exercises, flexion and extension and lateral flexion of the neck to the alternate sides. Do it a couple of times. Next is the neck rotation. Try to rotate the maximum as possible, changing the direction after a couple of times. This can be followed by the shoulder rotation. Move as much as possible. After 4 to 5 times, change the direction of the shoulder rotation. This is followed by shoulder Arnold, a complete range of motion of the shoulder, external rotation and abduction of the arms. Next is the chest expansion for a nice pectoral chest, side by side, nice stretch of the chest. Next is the forward chest expansion. Move your opposite arms upwards and backwards, flexion and extension, feeling a nice stretch on the chest as well as back. Now forward and backward flexion and extension of the spine. This is followed by the lateral flexion of the spine. Alternate sides at least 5 to 6 times. Next is the knee to chest, knee flexion. Try to maintain the balance. If you are not able to do this, you can skip this step. Be careful not to sustain a fall. Next is squat and reach. Squat downwards and try to reach up laterally. Do it 4 to 5 times for the mobility of the hands, legs and spine. Next is the hip rotation. Try to rotate as much as possible. Feel the stretch. Change the direction of the rotation. Next is the side lunges. Be careful. If you are not able to do it, you can skip this step. But this is good to stretch your hip joint and gives mobility to your hip joint. Next is the reverse lunges. Alternate legs and arms to feel a nice. Next, join your fists. Do a diagonal rotation of the arms as though chopping a wood, giving mobility to the upper back. This is followed by overhead abduction of the arm. Do it a couple of times. Next, fold your arms and do the lateral flexion, helping in the mobility of the spine. And lastly, join your hands for the entire spinal twist in both the direction, feeling a nice stretch, helping in the mobility of the spine. So that's it. Just few minutes of your day and I'm sure that you're feeling good. Just try to do this at least 4 or 5 times a week and I'm sure it will help you. Thank you.